If you've been lucky enough to get a thyroid diagnosis, chances are you're still not being treated properly. Millions of women are either misdiagnosed or put on a one size fits all treatment plan that leaves them just as exhausted, overweight, and frustrated as before. And here's the kicker, it's not just conventional doctors missing the mark. Even in the functional medicine space, thyroid treatment often falls short. That's why today we're setting the record straight with my absolute favorite thyroid doctor and dear friend, Dr. Amie Hornaman, aka the Thyroid Fixer. After her own battle with misdiagnosis and failed treatments, Dr. Amie made it her mission to uncover the right way to treat thyroid disorders. And she's here to share exactly what that looks like. In this episode, we're going to break down some of the biggest thyroid treatment myths that keep you stuck. The proper order of healing, where gut health, adrenals, lifestyle, and detoxification fit in. And we're going to talk about the role of GLP-1 medications in thyroid health, when to use them, and how to do it safely. So, if you're done with guessing, tired of being dismissed, and ready to finally get the answers you deserve, this episode is for you. So, welcome back to the show for, I'm thinking like maybe the fifth time. I think you might have a record, Amie.
I might have a record, I know, but you know what? We just love talking. So we just
We
decided
do.
to talk and record it at the same time.
Yeah,
So
exactly. Avi and I go back and forth daily, I would say, talking about thyroid, talking about hormones, and we have for years. We've bounced off of each other constantly when it comes to thyroid. I go to her for thyroid advice all the
I go
time
to
because
you for
she,
hormone.
yeah.
Yeah.
Because you're in the thick of it. You've been treating thousands and thousands of women for the last couple of years, and you really truly are the thyroid fixer. People come out of working with you with a functioning, optimized thyroid, which is nearly impossible, I find, out there in at least in the medical world, like the when you go to your doctor, your primary doctor. I still, to this day, 2025, you're going to be put on T4 medication. They're going to look at your TSH, nothing more, and send you out the door. Like it hasn't changed.
It hasn't changed. I mean, it's been almost 30 years since I was diagnosed, and I heard all of the same things that patients are hearing today. And I mean,
Yes.
just crazy, crazy stuff that comes out of these doctors' mouths from total dismissal, medical gaslighting, telling them that they're just getting older, they have to get used to it, that it's all in their head, so the patient thinks they're going crazy. I mean, it's bad out there. And then, yeah, to your point, if you do actually get properly diagnosed, you are getting put on the standard of care treatment, which is T4 only, which does not work. So all of your
No.
symptoms are going to remain. You're going to remain sick and you just won't get better. But that's the point of treating the thyroid, is to actually reverse those symptoms that came on from low thyroid function and get you to a place where you feel like yourself again. So conventional
Yeah.
medicine just doesn't do that.
It's failing miserably. Canada is even worse than the United States. Like we still don't have a lab that will test reverse T3. We can't get T3, T4 tested unless there's a problem with TSH. So they refuse unless you pay out of pocket, which yes, we should be paying out of pocket for it if need be. It's not a big deal. You poor Americans have to pay for it. Most things out of pocket. Canadians just
Right.
aren't used to it, so they don't. So they go by what their doctor's doing and they test for the TSH and they say everything's fine. What's interesting is prior to the use of T4 medication, originally they used desiccated thyroid, the medical
Mm-hmm.
system, and then
Yep.
it freaking changed.
Big pharma. We got to make
Big
the money,
pharma.
right?
Keep you
So,
sick.
yeah, to your point, natural desiccated thyroid was the first medication ever used to treat the thyroid. And then I can't remember what year it was that Synthroid came into being. And then,
Hmm.
funny, all of the medical textbooks changed. Everything the doctors were learning in med school changed. So, where it was like, well, T4 only works. So that's all you need to give your patient. And it's just an epic fail for people across the board.
Yeah. And just so like a little recap, and I'm going to link to the past episodes I've done with Amy's, and I would highly recommend going back and listening to them because we go through a lot of the details that we're talking about here today with when it comes to lab work and what you're looking for and why we don't want to just test TSH and then why, there's reverse T3 and the conversion problem. So we've done all of that. And I think a lot of thyroid patients that are listening to this podcast and that listen to your podcast, Amy, they're pretty aware now that what they're looking for in labs. And so if you're not, then I would go back, listen to what we've talked about in the past. But like a little recap of that is basically T4 is is not an active form of thyroid. Your body has to convert T4 into T3. And so we need typically we like 99% of the time a person needs a combination of T4 T3 or T3 only treatment. And so that's what we're talking about when we're saying like, oh, this is what standard of treatment is T4 only. And that's why that's a problem because it typically doesn't work because we're seeing more and more people. I don't know about you, but way more people, it seems like, with it being the conversion problem. So there's different types of thyroid issues, hypothyroidism, one of them being a conversion problem. And maybe you could just touch in on kind of what are the other types of hypothyroidism?
So yeah, we have number one, we have Hashimoto's. So if we look at all hypothyroidism, low and slow thyroid function, 95% of that is going to be autoimmune. It's going to be your immune system attacking your thyroid, and we call that Hashimoto's. So that's the autoimmune form of low and slow. Then we have different things like birth control. Birth control, the use of birth control for over 10 years, which I totally did, and most women listening did, actually increases your risk of hypothyroidism by 243%. Like it is
Whoa, I didn't
crazy.
know
People don't even
that.
it's birth control is horrible. And I know you talk about it as it relates to hormones because you and I
Yeah.
see 40 and 50-year-old women on birth control and we're like, what the hell are you doing? You got to get that's synthetic, fake hormones. It's going to mess you up. But a lot of people don't realize that the use of birth control can tank your thyroid itself as
Hmm.
well. So,
Hmm.
birth control, radiation, chemotherapy, certain drugs, certain medications, chronic stress, over exercising, like eating disorders, or what I used to do, competing, way over exercising and over dieting. That's a huge stressor on the body, and that usually will trigger Hashimoto's. So, when we're looking at hypothyroidism, we can really say most of the time it's an autoimmune condition that's occurring.
Okay. Yeah, and it doesn't always show up right away in labs. I've heard it can be like 10 years before you'll actually see it reflected.
Oh yeah, yeah. So there's stages to Hashimoto. So if we're just looking at Hashi, because we know like that 5% of the population with hypothyroidism, if it was caused by something else that we just mentioned, we can set that over here. You still want to be treated properly, so this still pertains to you. But when we're looking at, to your point, how long this could be occurring, and we look at the stages of Hashimoto's, you could have it for 10 to 20 years before it's actually diagnosed. And if you're an avid listener of Karen's podcast, you're taking care of yourself, you're doing the biohacking things, right? That alone can push your antibodies to zero and make it look like it's a false negative. So yes, you actually
Oh.
do have Hashimoto's, but you're living your life so well and so clean that those antibodies end up going to zero. So it's sometimes it's a little bit tricky to diagnose, but at the end of the day, whether someone has Hashimoto's, they don't know if they have Hashi, they don't have Hashi, whatever it is, if you have a thyroid problem, if your thyroid is low and slow functioning, you have to treat it properly. It doesn't matter what
Mhm.
label we give it, what tag we give it. You need to treat it properly if you want to feel your best.
When it comes to if it's a Hashimoto's driven hypothyroidism compared to a conversion T4 to T3 issue, Hashimoto's, the markers, what are we looking for? If we we'll look at the thyroid antibodies. Let's say they look normal. But that, like you just said, that doesn't mean that you don't have it
Right.
because it might not be showing up. Is
Yeah.
it most common to see it reflected in the free T4 and TSH? Or
Yes and
will you
no.
also get conversion and not have a problem with the TSH?
So, first of all, with Hashimoto's, we want to look at the TPO and the TGA antibodies. And And pausing on those, I want to mention we want those at zero. So a lot of labs down here in the States, they will have, let's say TPO, for example, the TPO standard lab value range that you see off to the side of your value. That standard lab value range can be less than 34, meaning if you come in with a TPO marker of a 20, your doctor is going to say, no, you do not have Hashimoto's. And even some functional practitioners out there will say, no, you do not have Hashimoto's. And I get patients all the time that say, well, I was told I don't have it. I go, well, you have 20 antibodies right here. So if you think of Hashimoto antibodies like soldiers that are going out and attacking your thyroid because they think it's a bad guy. So any kind of autoimmune condition, you have to think of soldiers that are attacking that thing, that gland, that body part. Take rheumatoid arthritis attacking your joints, Hashimoto's attacking your thyroid. So you have 20 soldiers that like to go out and beat up your thyroid gland because they think it's a bad guy. Are we just going to wait until you build up to 35 soldiers where you actually get flagged high? You get that little H next to your value. Maybe it turns red. And then your practitioner looks at it and goes, oh, look, it's Hashimoto's. Meanwhile, the destruction of your thyroid gland is occurring over and over and over again with those 20 or 10 or 5 soldiers that are present. What I say is we want those antibodies at zero, dead zero. And if they're not at zero, and if you have an antibody is a soldier that's attacking your thyroid. So even if somebody has little antibodies, we still look at that and say, okay, Hashimoto's is present. Now, ultimately, we want to stop that destruction from happening.
Mm-hmm.
When that destruction is happening, it causes stress on the body, it causes inflammation. That can drive up reverse T3, but as we know, there are so many factors that
Yeah.
that occur to drive up reverse T3, which then comes back to your statement about a conversion issue. And those factors, oh my gosh, estrogen dominance, insulin resistance, a genetic SNP, low nutrients, low magnesium, vitamin D, iodine. I mean, there's so many things that influence conversion. I often say, really converting that inactive T4 to the active form T3 for your body, it's like running 5 Tough Mudders in a row. It is hard. And
Yes.
that's what, oh my God, that's what pisses me off about conventional medicine, where they go, oh, yeah, no, it's okay. Your body will convert this. Just take this T4. Good luck. See ya. And it's like, wait a minute. You don't even know me as a patient. You tested my estrogen? Have you tested my insulin? Have you tested my vitamin D, my magnesium, my iodine, my selenium? Have you tested all that? For you to just give me T4 and we cross our fingers and wish on our rainbow that it converts is
Mhm.
crazy. It is crazy. So yes, conversion issues are big in the thyroid space. We see a lot of elevated reverse T3 these days, especially with glucose control and the processed foods and insulin resistance that we're seeing rampant across the board. Yeah, there's a lot of conversion issues as well.
Mhm.
But
Mhm.
you have to still look at that full picture and go to the patient and go, okay, how do you feel? Regardless of the numbers, how do you feel? Because when you have those symptoms, then we pair that up with the numbers and we go, okay, yeah, that makes sense. That makes sense. Oh, here you have Hashimoto's. You've been under attack for 10 years and your reverse T3 is elevated, putting you in survival mode. So, Susie, it totally makes sense that you're gaining weight, losing your hair, and you can't get going during the day and you have no energy. Totally makes sense.
Yeah. Oh, I could go on so many directions here because I want to pick your brain. And before we continue, I do want to tell the audience, in case they don't make it all the way to the end, which you better, but in case you don't, Amie and I decided we're going to put on a free webinar, just because we do want to dive in deeper to this. And we always get a lot of questions being sent in after we do these interviews. And I want you guys to be able to access her knowledge. And so we are going to be doing a free webinar on thyroid where you can come in and you get to join us on the call and ask your questions. And we will be recording it so you can watch the replay if you can't make it live. So we'll have that link in the show notes, but we'll talk about it at the end of the interview. So just everybody heads up on that, because you're going to want to partake. I think it'll be really, really great. And I love giving the opportunity to my listeners to ask the questions, and it gives them an opportunity to get to know you and what you could do for them. So I think that that'll be great. Uh, okay, so let's now go back to the unfortunate issue of it's not just medical doctors. And I don't want this to sound like we're bashing functional medicine practitioners or even med doctors. Medical doctors are, this is what they're learning in school, right? So we have to,
Right.
and it sucks that they don't go out and do their own education, but they usually don't have time or not really wanting to do that because they don't specialize in thyroid. So to them, it's like, man, functional medicine practitioners, a lot of them do, their niche is thyroid, and that's what they want to be doing in their practice primarily is working with thyroid patients, or thyroid patients will oftentimes spend the money to go to a functional practitioner in hopes that, okay, I'm not going to go see my medical doctor. I'm going to see a functional doctor and they're going to be able to help me with my thyroid and properly. And unfortunately, Amie and I both, we're seeing the other side of that where we get all these patients coming to us going, I went to the functional medicine practitioner. I've worked on my gut. I've worked on my adrenals. I'm taking all these supplements and I still feel like garbage. I'm still hypothyroid. I'm still overweight. So what's the problem with that approach?
Yeah. Yeah. So functional medicine, to expand on your point, is phenomenal. I'm so happy that it's come into kind of just run of the mill talk.
Yeah.
It's not in this private secret group where you have to be a biohacker like Brian Johnson to get functional medicine. Right? It's growing. It's growing. And especially down here in the US, people are realizing, hey, I might not get the help I need from my insurance-based provider because I get a 5 to 7 minute visit with them. I want more. I want someone that asks me how I feel. I want someone that sits with me and looks at my labs. I want that time. So they go to functional medicine. But here's where, and I am very open about this too, because it's almost like a public service announcement, buyer beware. Just because you go to someone that has functional or integrative or alternative in their title, number one, it does not mean that they can prescribe thyroid medication. So, and hormones. So this goes across the board. We've seen this over and over again where someone will go to a functional, I'm using air quotes here, functional prescriber or practitioner. And because they can't prescribe, they load this person down with supplements. And
Mhm.
then they say, well, you know what? With your thyroid problem, you don't need thyroid medication. You need to do an adrenal healing protocol, a gut healing protocol. You need to do this detox. And, they have to make money too. So basically, they're giving you what they can do, but not necessarily what you need. And they're
Mhm.
making promises that don't quite line up with physiology. We are not going to all of a sudden magically make your thyroid gland heal and be well again and produce T3 to give you a metabolism and energy and grow your hair and all the things by healing your gut. Like gut healing's awesome. Yeah, go ahead and do it all day long, but it's not going to magically produce more T3. If you don't have a thyroid, do you really think that any of these things is going to replace the thyroid hormones that your thyroid gland used to make when it was there? We can't
Mhm.
heal we can't wave a magic wand and heal your thyroid that's no longer there and make your body produce T4 and T3 by fixing your adrenals. Like you need thyroid medication. So that's the issue that I see. If we're really laying it out and being truthful,
Mhm.
there are people out there that either they don't know the thyroid inside and out. Maybe they can prescribe, but they'll do a one size fits all approach the same way as conventional medicine because they don't know. And I know you've seen this with hormones too,
Yes.
right? And I heard you talk about it on your last podcast. Everybody gets the same thing. You come in, everybody gets the cream, everybody gets the patch, everybody gets a, and it's like a one size fits all approach with thyroid and hormones. And thyroid and hormones are nuanced. Like
Yes.
they are unique, bio individual. It's a nuanced art to get you optimized. And that's going to take more than these BS programs that are being pumped out there where people spend thousands of dollars and then they're frustrated because it doesn't work. So you
Right.
really need to look at what is being promised and look at what you actually need. And Karen and I are very, very vocal about we love thyroid hormone. We love the sex hormones. We love bioidentical hormones. Like hormones give us life. And we can't put thyroid hormone and bioidentical hormone replacement in the medication category. You have to look at any hormone as a beautiful tool to keep you off of the band-aid medications that you don't want to be on, off of the statins and the blood pressure meds and the antidepressants and the sleeping pills and the anti-anxiety meds and all of that. So that's where we go to hormone replacement is hormone replacement, and that is the way to go. And you're not going to build up new hormones by doing some BS functional integrative protocols that
Yes.
promise results and don't get them.
And we're not saying that these things aren't important. They are. Amie and
Right.
I both practice
Right.
functional medicine. Like that's what we do in our clinics. And so we know the importance of diet, lifestyle, detoxification, adrenal health, stress management, gut health. Oh my gosh, these are key things that have to be part of this puzzle, this thyroid puzzle. So we're not disregarding.
Right.
What we're saying is we have to have a combination of things because, for example, if you have gut problems, we were just talking about this, is let's say you've got chronic SIBO problems, small intestinal bacterial overgrowth, or you're constipated all the time. So you go to a practitioner that's like, oh, wow, you've got all these gut problems. We got to fix the gut, and then that's going to fix your thyroid. But what if it's the thyroid, which in most cases it is, the slow, sluggish thyroid that's slowing down the function of your bowels,
Yep.
causing the small intestinal bacteria overgrowth, causing the sluggish liver, causing all of these bowel digestive problems. So, what if we put in the thyroid medication first
Mm-hmm.
and got things rolling properly? And then reassessed and was like, okay, is there any sort of like, is there still some gut dysbiosis that needs to be cleared up so that this can function even better? Right?
Right. Right. Oh, I love how you think. I love that we think the same way too.
Yeah.
But you're right. I literally just got this question yesterday. And it was from a woman. She said, well, I have H. pylori, so I'm thinking I should focus on and treat the H. pylori first and then do the thyroid. And I said, no, actually, it's the other way around. You can do it at the same time, but it really is the other way around because you could work on H. pylori for months. And now your thyroid is going lower and lower and lower. And now you're not treating it properly and you feel worse and you gain more weight. And now the whole system is sluggish and you can't detox and you feel worse and you feel, oh, but you're treating your H. pylori. No, you want to go the opposite. And to your point about SIBO, all day long, whether it's SIBO, constipation, dysbiosis, I mean, you have to start with the master gland, which is the thyroid.
Yes, yes. And let's talk about that system when it comes to the adrenals, because that I probably hear more than the gut stuff, which it's always gut and adrenals that people are saying you just got to fix those and then your thyroid is going to work.
Yeah.
And the adrenal system, yes, has a very close relationship with thyroid. But why is that an issue to just focus on the adrenals first?
Well, so Paul Robinson says this the best, and you and I were talking about this before, where cortisol needs T3, T3 needs cortisol. So someone, and we hear this all the time, well, oh, my adrenals are burnout. I have adrenal fatigue. Well, number one, sometimes you do, sometimes you don't. Sometimes you might just think that you do, but you have to check that properly and get a full cortisol, 4 point saliva cortisol panel to really know, are you flatline, bottomed out? You're not making cortisol at all, or are you high cortisol where you're pumping out too much cortisol through the day? Both of which can affect the thyroid.
Mhm.
So low cortisol says we need T3. We need that T3 in the mix to get you out of that adrenal exhaustion, adrenal fatigue, basically bottomed out state. So that's where you could be taking all the glandulars and adrenal protocols you want, but you don't have enough T3 on board. that cortisol is going to remain low and it's going to drag your T3 and your thyroid function down with it. When you have high cortisol, that produces a reverse T3, a conversion issue, and that significantly impacts your T3 to T4 to T3 conversion. So again, when we have high cortisol and elevated reverse T3, we ultimately want less T4 and more T3. So we can see where the proper thyroid treatment is going to come in first. Then, once we optimize your thyroid, now let's retest your adrenals and see where you're actually at. Because the last thing you want to do is start throwing adrenal supplements at your body
Yeah.
and not address that root cause, that master gland, the thyroid. Because
Yeah.
then it just gets it gets the whole system messed up. You could be worse off than you were.
Oh, and not even to like this could be a whole nother podcast, but the adrenal supplements that are out there, you have to be
Ugh.
so careful because they're just like, oh, you have an adrenal problem. Take all of these supplements they just combine in these in a one pill, and it's got things that will raise cortisol, lower cortisol. Like your body doesn't know what to do with all of that. And that's not getting to the root of the problem. You think that you are because you're taking natural herbals,
Yeah.
but what if it's because you don't have enough T3? When I was diagnosed with my reverse T3 problem, finally, after being put on the wrong types of medication, this was many, many years ago, I reached out to Paul Robinson. So Paul Robinson discovered the circadian T3 method that Amy's talking about. And I was working with him because he's so knowledgeable about reverse T3 and T3 in general and cortisol and he was like, okay, because I wasn't feeling good. I was on all this T3 medication. I still wasn't feeling well. And we looked at my cortisol and my DHEA, my adrenal hormones, and they were flatlined. I was in total adrenal insufficiency. And I felt it. And so he was like, okay, we're going to change this around. You're going to do the T3 method, which is basically you take T3 at certain times of the day to help your body. It's the trigger for the cortisol to come on. So you can imagine it's like the light, somebody turning on the light switch. So your cortisol is supposed to come up first thing in the morning and spike. T3 drives that spike. And so he laid out this protocol for me. And within a month, my adrenal system went back to normal. My cortisol went up. It affected three of my four cortisol markers, which was fine because the last one I wanted to be low because that's the nighttime cortisol. But basically, it bumped up my cortisol to where it needed to be. And no
Hmm.
amount of adrenals were doing that. I was taking all the adrenal supplements, so trying all these different things and glandulars and this and that. It was that. It was
Yeah.
fixing the getting T3 into my body that did it. And so
Hmm.
that just goes to show it's proof. And we'll see this time and time again with people where they feel like this until they start taking thyroid medication.
Yep. Exactly.
Oh,
And then we save them from wasting money too, because that's expensive
yes.
to do
Yeah.
all of those protocols and then buy the supplements and then have them not work. I mean, that's as frustrating as going to your doctor and getting dismissed and being given T4. It's like you're wasting my time, you're wasting my life. We only have so many days on this earth. Let's feel good every single day
Mhm.
and live life to the fullest. And we can't do that when we're chasing our tails trying to figure it out for ourselves and getting wrong information.
And how do women feel, right, Amy? Like, tell me what's an average patient, hypothyroid patient coming to you? Are if they're not optimized or taking thyroid medication and they're hypothyroid, how are they feeling? Are they up for taking on protocols and doing all this work and helping their body to lose weight and finding the energy? Like, no.
Yeah. No. No, they're just tired. They're so tired and their bodies aren't even what they're used to seeing. We hear it all the time that I just don't even recognize the woman that I'm seeing in the mirror anymore. And that's true. It's like your body rebels against you. You're exhausted. You're exhausted from trying to figure it out. You're exhausted from searching Dr. Google, looking at Instagram. You're just tired of the whole
Mhm.
thing. So that's the
Mhm.
last thing that they want. And I always tell people when they're like, well, how much do I have to do? I'm like, why don't you just sit back and let us do it for you?
Yeah.
Like, you just sit there and you take what we tell you to take. And I mean, that sounds so blasé, but it's not. It's actually a stress relief to where the woman's like, okay, so I don't have to, do five different protocols and wake up in the middle of the night and take a binder and then do a test every single day and time my supplement. No, just let's get you on track. Let's get your thyroid optimized. Let's get some hormones and let's do it the right way and you'll be fine. And you don't have to
Yeah.
exhaust yourself every day.
Yeah. I always say to them, like, don't do anything. Just take the medication.
Yeah.
And then guess what's going to happen? 4 weeks from now, you're going to have energy and you're going to be like, all right, give me the supplements, give me the
Right.
workout plan, give me the food plan because now I can. Right?
Yeah.
When you're tired and you're depressed and you're overweight, your mitochondria is just like so slow. You got no energy in your system. A lot of the time we'll see low iron in women, like so
Hmm.
many problems going on. The adrenals, the iron, the gut, everything.
Yeah.
And then you give them this medication, and then they're like, oh, okay, I'm actually feeling like a normal human being. Now I can start working on getting to the root of the problem
Yeah.
and going deeper and fixing all of these little puzzle pieces that we're talking about. And you can then start honing in on them and going, okay, what needs working on now? Now that I'm feeling good, like I found out I had heavy metals, and I think that was my driving factor for my thyroid. Well, guess what, ladies? Heavy metals, may not ever get out of my body.
Yeah.
And some of them are like, oh, lead can take up to 7 years to clear out. So, do I want to spend 7 years overweight, can't get off my couch, and depressed with itchy skin and thin hair? No, thank you.
Right. Right. Exactly. No, you want results yesterday when you're feeling that bad.
Yeah. Yeah. And that's same with hormones too. I would say like sometimes we have to put the hormones in first just so you can start to feel better. And then you can work on all the lifestyle functional pieces.
Hmm.
That makes so much more sense to me. And you'll get people that are like, but I don't want to take a pill, and I don't want to be on medication for the rest of my life. I'm going to try and get to the root of the problem without it. I get this all the
All the
time. The real
time.
stubborn people.
I get
We
it
have
too.
friends that are like that. That it's just like, but your body needs the thyroid right now. And what if you never get to the root of the problem?
Well, yeah, and I get that question a lot. Like, so what
Mhm.
is the root cause of my hypothyroidism? And then my answer is, what does it actually matter? The root cause of your symptoms is the thyroid. So if you really want to talk about how you feel, how do you feel? Okay, well, I'm gaining weight, I have no energy, I'm losing my hair, I'm constipated, I'm losing the outer corner of my eyebrows, whatever it is, I'm cold all the time, whatever your symptoms are. Those symptoms, the root cause of those symptoms is low thyroid function. Now, when we go, okay, well, what caused the low thyroid function? Who cares? It could have been pregnancy. What, are you going to go back and undo it? It could be Epstein-Barr virus. Guess what? We all have it. I have not found one person that does not have EBV. So all y'all had mono at some point in time in your life, whether you know
Yes.
it or not. And that is a huge trigger of
Huge.
Hashimoto's. So it's like, even if you find the root cause and you go, oh, I had mono, I have EBV. Okay. And now what? Again, like, you're not going to get rid of your EBV. You can suppress it, and 99.9% of the time it is suppressed. It's in its dormant state. Yeah, it can kick up, but it's in its dormant state. What are you going to do about it? If pregnancy is the root cause, what are you going to do about it? Why don't you just focus on getting better and actually treating your thyroid that is contributing to these symptoms that's ruining your life? So yeah, I had to comment on that. I get
Oh,
that all the time, all the time.
yeah. Hallelujah. Yeah, exactly. Exactly. And it's because we just don't know sometimes. I remember my naturopath saying to me when I was diagnosed, I was like, and I asked him, I was like, why do you think I have it? Like, why is this happening? Why can't I convert T4 to T3? And he's like, it could just be genetics, could be familial, it could be, a number
Yeah,
of things. But
yeah.
basically, like take the medication. And if something you do starts to work and makes your thyroid function better, awesome. Then you can come off of it.
Hmm.
Great. Right. And that's, I think, the way we have to think about it is I'm going to medicate myself because my thyroid's not running properly. And then I'll work on the finding different root causes or helping my thyroid to function better. And if I become hyper because my thyroid starts to work really well, then I'll come off the medication. It's
That's
that
simple.
simple,
It's that simple. Yeah, exactly.
which that makes me want to talk now about GLP-1s because interestingly, and
Transition.
yes, I was on 75 micrograms of T3 medication for about 4 years, 5 years, something like that. 5 years? 5 years. And that's where I felt great. I tried going higher, I tried going lower, and but that was like where I felt my best. Not higher than that, I didn't feel anything. Lower than that, I would start to get hypo symptoms come back and I'd start to get depressed. Like within a week, if I tried to
Yeah.
drop that dose, I was like 1 week and I was like, oh, my mood would plummet. It was always my sign, like, ooh, no, not good. And so I went on GLP-1 medications about almost 2 years ago now. And it helped me to lose that weight that just wasn't, I'd gained some weight with menopause and then my thyroid had a little crash. And so, anyways, I go on the GLP-1 medications to get off that extra weight. And it was great. It lowered my inflammation. I felt amazing. My gut health got so much better. I suddenly had no more food sensitivities. I could eat things that I couldn't eat before. And I get regular testing done on my thyroid. So I go get my thyroid tested as usual, twice per year. And it's all my T3 is over range for the first time in 5 years. And I take it at exact same time every time I test. Like I take it the day before at certain times of the day and then go test the next morning. So
Mm-hmm.
I had changed nothing. And I was like, oh, that's weird. So I thought, well, maybe I'll lower my dose. And so I did. And
Mm-hmm.
then I lowered it some more and some more. And so now I'm on, well, I kind of took your advice on that because I had actually consulted with Dr. Amie about it. And so I kind of moved between 50 micrograms and 40 micrograms, like somewhere in there. So I kind of go up and down and I'm not getting any hypo symptoms. I feel great. So I had come to you, Amy, and was like, are you seeing this in your practice? Because I've had some of our members say the same thing, that they
Mm-hmm.
became hyper and had to lower their thyroid. So there's something about GLPs that are helping the thyroid to function better. So can you talk about that? What are you seeing? Because I know you use these in your practice, right?
Yeah, yeah. We use the microdosing technique unless someone is full blown, type 2 diabetic or they have 50 pounds to lose more than, then obviously we'll use a higher dose. But we really like using the microdose of the GLPs because it reduces inflammation big time, like full body systemic inflammation. It improves insulin resistance, it improves glucose control. And when used properly at that microdose, it does provide a layer of food control. So when you're using it at the microdose, we're not looking to totally crush your appetite. We'll get more into that. But we just want that food control. So all of that works together to significantly lower inflammation in the body. Now, I did the same thing that you did, Karen. So I'm on 75 twice a day. And there was a time where I tried to pull 25 micrograms out just to lower it. And it's not, let me paraphrase this too. It's not that we want to lower your thyroid medication to as low as possible. You need what you need. Your optimal dose is your optimal dose. Not a big deal. However, for me, I'm on such a high dose of T3 because that's what my body requires and has for 20 years. With that high of a dose of T3, you do risk a little bit of muscle loss because T3 doesn't differentiate between fat loss and muscle loss. So, of course, I do all the things to protect my muscle. But with that high of a dose, I realize that that is a potential effect of that T3. So there was a time I tried to pull out 25, just like you, in 1 week, like clinically depressed, to the point
Wow.
where I was like,
Yeah.
oh, this is what people mean by they don't want to get out of bed in the morning.
Yes.
Like,
Yeah.
wow. And I put on weight. So I'm like, okay, can't
Yeah.
reduce my T3, but with the GLPs, same thing. I tried the GLPs years ago at the high dose. Definitely experienced the side effects, all of that. When they first came out, when Manjaro literally first hit the market, that's when I tried it. Then I got off of it, backed away, then started going down the rabbit hole of microdosing. And I thought, okay, well, this makes sense. So now I've been microdosing for maybe about a year, and I can now reduce my T3 by 25. I haven't tried to pull it down by 50, but I can absolutely reduce it by 25 and no hypo symptoms, nothing. Here's the other thing with GLPs. So since you and I actually experienced that depression low, GLPs are working to improve mood. So we are seeing across the board, and I have heard this across the board with my patients too. Like, oh my gosh, I just feel better. Like I almost feel like I'm taking an antidepressant without the side effects of it. My mood is better, my focus is better, my brain is better. So we're seeing that occur in a multitude of patients, and definitely the reduction of thyroid hormone medication dosing we can pull back on.
Yeah, I mean, there's unfortunately not any research. Like I've tried to find, okay, well, what is this helping our thyroid?
Yeah.
Because they all have a black box warning that says this can cause thyroid cancer, the GLP-1. So can you
Right.
talk about the black box warning
Oh, yeah. Yeah. You don't even have
as
to
a
worry about
thyroid
that, like, at
expert?
all. Yeah. It's a moot point. You don't even have to worry about it. When they discovered, so first of all, they tested rats, and okay, that's fine for some things, but when we're testing thyroid function and cancer, there's a huge difference between rats and people. Huge. Not only that, but they also gave these rats literally 20 times the dose of a GLP that would ever be given to a human. If we gave you the dose that would be equal to what they gave to the rats and a GLP, you would never take it again. You would be so sick. You'd be vomiting all over the place. You would have no appetite. You would have heartburn for days. You wouldn't sleep because of the heartburn. Like you would be absolutely miserable. No one's going to take that dose, like ever in a million years, ever. So the whole thyroid cancer thing, total moot point. We don't even have to worry about it. And in fact,
Yeah.
when you look at the mechanism of action of a GLP, if we are okay, we know cancer cells of any kind feed on glucose. Cancer cells love sugar. So really the fastest way to increase your risk of cancer, keep your glucose high and be insulin resistant, be type 2 diabetic. All day long, that is going to increase your risk of cancer, Alzheimer's, pretty much every disease under the sun, heart disease because of the obesity and the blood sugar control. Lowering glucose and lowering insulin and making someone more insulin sensitive and more metabolically active is going to actually prevent cancer and lower your risk of cancer. So the fact that they're tying this really, really, really high dose of a GLP to thyroid cancer, I wouldn't even worry about it.
Which hasn't been replicated in a human yet.
Right. That too. That too.
So
Yeah.
that says something.
Right. Exactly.
Now, when you say microdose, Amy, can you tell us what that looks like? Because I think that that word is getting thrown around a lot right now, and
Yeah.
we're seeing a lot of people that are like, "Oh, I want to do the GLP ones as long as it's a microdose," and it's very vague when you start looking at, well, what does a microdose even mean?
Yeah. Yeah. So it really is. I'm finding it's different for every single person. So I have one patient that, I mean, literally her dose of tirzepatide, the micro dose of tirzepatide is like 0.25, I want to say. Like
Wow.
it is it's like microscopically low. But if we take her up to the micro dose that I take, she would lose her mind. Like she's so sensitive. She would completely lose her appetite, not be able to eat at all. And that's not the point. When we use these micro doses or lower than the pharmaceutical standard dose, let's say that. So a microdose is a lower dose than what would be used in standardized medicine if we were to prescribe these to a type 2 diabetic. So if we're prescribing to a type 2 diabetic, let's just use tirzepatide for an example. We would prescribe 5 milligrams, 7.5, 10, and then we would continue to go up. And as we go up in that dose, that's where problems occur, side effects occur, symptoms occur. So we take that five, we say, okay, five would be a standard dose. Maybe your microdose is 2.5. Maybe it's a one. Maybe it's a point 0.5. We have to find where that sweet spot is to A, still get you into that metabolically active, insulin sensitive state, to gently lose weight. We are not using this like Hollywood's using it, where you're losing your face and you're losing your ass and you're losing all your muscle and you look like garbage and you look 10 years older than you are. Oh, but you lost 10 pounds in 2 weeks. Good job. So we're not using it like that. We want nice, steady, steady, steady weight loss, almost like you can't even notice it happening. It's like 4 to 6 months down the road. You're like, oh, yeah, you know what? I did lose those 10 pounds. Wow, that happened really slowly. And I didn't have to deprive myself. That was awesome. So we want a dose where you do not lose your appetite, but yet you have, you just go, you know what? There's less inflammation. I can lower my thyroid dose. I lost a couple pounds. My clothes are fitting better. That's what we want. Or your mood is
Hmm.
better too, because that
Hmm.
happens as well.
Yeah, and there's immune receptors, or sorry, GLP-1 receptors on immune cells. So it can help with, I would think, with Hashimoto's. I mean, I
Yes.
have no
Yes,
proof
yes,
of
yes.
this. This is just, I would just assume that that's also a mechanism of action of how it's helping with thyroid.
Oh yeah, yeah. Especially people with high antibodies or when we see autoimmune crest into other autoimmune conditions. So we see someone with Hashimoto's and they have celiac and they have rheumatoid arthritis or they have psoriasis. That that effect on the immune system of calming the immune system down can actually protect someone from that autoimmune condition spreading into other conditions. And then
Mm.
the reduction of joint pain is huge. Well, this was a story given to me by one of my colleagues who's a nurse practitioner. She had a patient, she started her on a GLP. She intended to microdose her, but the patient took too much and misunderstood the dosing on the syringe and all that. So basically, she took double what the normal dose for therapeutic reasons would be. She felt horrible. However, this woman also suffered from debilitating arthritis. I don't know whether it was rheumatoid or not, but debilitating arthritis for decades. Was on these, big prednisone. Um, what are the prescription
Yeah.
ibuprofen? Just horrible meds that destroyed her gut. And she couldn't get off of them because, I mean, she would have pain. This high dose of GLP that she took wiped out all of her pain. She got to get off of her prednisone. She got off of the ibuprofen. And now she is microdosing and maintaining that level of a low inflamed state where her joints don't hurt anymore. It's crazy.
Mm. Amazing. And then on
Yeah.
the flip side of that too, like your patients are all optimized on thyroid, but we get a lot of people who don't even realize they have a thyroid problem and they're coming into our peptide program just to lose weight, just to get access to peptides. And I will tell you, so this has been going for 2 years, this group. And the number one reason why somebody won't lose weight on a GLP-1
Yeah.
is an undiagnosed thyroid problem.
Yeah.
Number one reason. It's almost every single time. It's like, second to that is they're not optimized on their hormones.
Right.
But number one is thyroid. And I'll say, when was the last time you did a thyroid panel? Go out and get one. Because they're like, I've been on this dose for 3 months and I've only lost 2 pounds. I'm like, no, these work way better than that. You should be losing weight. There's
Hmm.
something else going on. So don't just keep raising your dose, raising your dose. So if you're listening and you tried a GLP-1 without success, you may be wanting to check your thyroid,
Yeah. Yeah.
right? Yeah.
Definitely. That is absolutely the number one reason why someone does not lose weight on a GLP all day
Yeah.
long. Yeah.
Yeah. Which those GLPs, I mean, they'll make the toughest cookies lose weight, right? Like they work extremely
Work.
well, even with the toughest of cases.
Yeah.
But that thyroid, that just goes to show the importance of thyroid. And thyroid can become a problem. You could have never had a thyroid problem your whole life. And then suddenly you hit midlife and you're gaining all this weight. And then you're like, okay, I'm going to go do this GLP and you don't lose weight.
Hmm.
This could be because of thyropause. So tell me about
Thyropause.
thyropause.
Yeah, thyropause. It's a real thing. So you and I both talked about it. And I define it as when your thyroid gland shits the bed after the age of 40 due to fluctuating hormones. So we know that right around 40 is ish, sometimes before, sometimes a little after, women will start to go into perimenopause. So we see, and you talk about this all the time, progesterone levels decline first. That can occur at any point. That can occur in your 20s, 30s, 40s, then followed by testosterone. Then your estrogen goes on a nice little roller coaster before it totally falls off the cliff. And none of us are getting away with not aging. Like we're unless somebody has figured out how to age like Benjamin Button, let me know if you have. But I haven't found it yet. So we are all going to lose hormone function and our hormones are going to go on a wacky wild ride. After the age of 40, this is normally where we see thyroid problems occur because, like we said earlier, the triggers of hypothyroidism, Hashimoto's, hormonal disrest, a hormonal imbalance, a hormonal roller coaster. Well, that occurs during pregnancy. So we know that, listen, pregnancy is a very natural thing that a woman's body was built to do, but it is hormonal chaos during that time. And that is why after pregnancy, you will hear a woman say, it was after my first kid, it all went to hell in a handbasket. I started gaining weight, losing my hair, all of that. Same thing with perimenopause, thyropause. This is where we see women go, it was, right around 40, 41 that I gained all this weight and my hair fell out. And now I have no energy and no libido. I don't know what's going on. Yes, there's the hormonal decline that you have to address, but then you have to look at your thyroid function because that hormonal roller coaster that your body is on can literally turn on Hashimoto's. It can be in the off position, like a light switch, for a long, long, long time, decades, decades, decades. And then you go through that hormonal disarray in perimenopause and it turns into the on position. Now you have Hashimoto's. So, yeah, thyropause is real. It's real. I believe every single woman on their 40th birthday, if they don't have symptoms before then, you got to go get a full thyroid panel. And if you don't have symptoms at that point, great. Then that's your baseline. So that if things start to occur in the years to come, you have that baseline to go back to say, well, this is where I felt good. And now I don't. So what's going on? And you can actually compare those numbers.
Mhm. And what I see is it's not typically out of range, and I don't typically see TSH going up. What I see over and over and over and over again from literally thousands of labs that I've looked at is the T3 is at the very bottom of the range. So it's not
Mm-hmm.
flagged. TSH will be normal, T4 will be normal. There might be some antibodies, but it's that T3 that just went and
Yep.
plummeted, but not enough to be out of range. And so
Right.
then it's like, it never gets caught, right, by normal medical practitioners because it just looks normal. And it's like, yes, but it's not. And sometimes put like a lot of I'll tell my patients that I'll say, let's replace the hormones first. Because a lot of the time that's enough to get that thyroid to function better. But sometimes it's not. And sometimes they do need to replace their thyroid like they do their other hormones once they get into perimenopause and menopause. It's just, unfortunately, that's just the case.
It just is. I mean, if you want to
Just
live a
is.
good life,
Yeah.
if you want to feel your best, look your best, perform your best, then you need to focus on the thyroid and fix the thyroid.
You've been working like the front lines in thyroid. Like you're not just talking the talk. You're in there working. You're in the trenches, Amie. You still take private clients.
Hmm.
You have a thriving practice and you have literally helped thousands and thousands of thyroid patients at this point. And so I want to ask you, just so everybody can get a really good idea of what we're talking about and why we're so passionate about getting this information out there, because I think that we're being misled. And so my question for you is, you're working with all these people every single day. in your practice. And these women are typically doing everything right. They come to you usually pretty knowledgeable because they've been listening to your podcast, right? They're listening to the summits that you do. They're out there, they're really trying to educate themselves. So it's the educated patient that is trying to take care of their health. They're trying to exercise, they're trying to eat well, they're doing all the right things. They come to you. How often would you say one of your patients gets off of thyroid medication after a period of time working with you? Like, let's say you optimize their thyroid and they're working on all the things, they're doing everything right. How often is it that you're like, oh, your thyroid's functioning so much better, we got to lower your dose?
So lowering the dose, sure. Does that
Yeah.
happen? Absolutely. Absolutely. From a variety of reasons. It might be the GLP, it might be all the biohacking they're doing. It might just be that their whole body is now in sync and working like a symphony and we can lower their dose. But to get off of thyroid medication, I would say never. And here's why.
Wow.
Here's why. Because once we see that person, that patient, they've been dealing with this for a while. They've already been through the conventional system. Maybe they've dabbled in the functional system, been disappointed there, like we were talking about. And now their thyroid is so far in the hole. Even if, honestly, even if they just found out that they have a thyroid problem, that's been going on before their official diagnosis. That's been going on for years. So at that point, it's like, is the goal really to have this badge of honor that I don't take thyroid medication? Yay. Or is the goal to feel your absolute best? And I say this every single time I get this question. You would have to pry my thyroid hormone out of my dead cold hands. And at that point in time is when I will stop taking thyroid hormone, when I am dead, because I want to live my best life. And I see nothing wrong with taking hormones in that you need. So an analogy I always like to use, especially with, and these people, they're like, I just don't want to take a prescription. It's
Yeah.
like they have this
Yeah.
mental block that if they have
Yeah.
that little, orange bottle or what, I just don't want to take a prescription. I go, okay, so if your child was diagnosed with type 1 diabetes and the doctor came in and said, your child needs insulin. Insulin is a hormone, but it is a medication. Would you go, oh, yeah, no, I don't want my child to take insulin? The doctor would be like, well, then your child's going to die because you need insulin to survive. Now, will you absolutely die without thyroid medication? I mean, maybe eventually one day when your heart shits the bed and your brain doesn't work anymore and you get Alzheimer's, yeah, but you're not going to live a great life without it either. It might be a really long, slow death as your body just slows down to the point where it doesn't function anymore, but that's not fun. So it's a case by case basis. But for me and for what we see in the practice,
Mhm.
no, no, we
No,
don't get
I
people
don't
off of
see it
it.
either. No.
Yeah, no,
Yeah. Like I want that for everybody. I want that for myself. I would love it. I would love to be able to get everybody off of the thyroid and not depend on it, but I don't see it happening. I
yeah,
just don't. And maybe that's why. Maybe it's because they've had this lifetime of thyroid destruction happening quietly behind the closed doors, slowly eating away at your thyroid. Or maybe it's just this is just the card you were dealt with, and all of the toxic load that's in our environment can't be escaped, and your body just can't handle it. And
right.
therefore, let's give it some thyroid medication to help deal with all of it. And they end up having to usually stay on it. Yes, we can maybe sometimes shrink the dose down, but I see a lot of the time too, the dose has to go up a lot of the time with different things that are happening in life, right?
Yeah.
More stress, winter time, like
Hmm.
different things that will make them go, suddenly they're like, oh, I don't feel as good anymore. I'm hypo
Yeah.
again.
Yeah.
And this is just the
Exactly.
reality, you guys. It sucks. It sucks. I wish it wasn't that way. And I tried for so long to figure that out for myself and think, oh, I just want to get off this medication. I don't want to take it for the rest of my life. And then I was like, just don't even go there. Like, don't, you're just stressing yourself out even more.
Yeah. 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 Totally.
Right? And if I can shrink back on my dose, great. And that's what I've been able to do with the GLPs. And so that's just an added bonus. That's the way I see it. And it's like, great if I can shrink back on my dose. Our good friend Elle Russ, actually, I always think of her too. She was finally diagnosed. She had a reverse T3 problem like you and I,
Hmm.
was on a boatload of medication. I think she was started at like 150 micrograms, same as you. And then over the last 10, 15 years, she was slowly able to get down. But I mean, this took over a decade
Yeah.
till she finally tried to completely come off of it and got her symptoms back. And
She
she ended
messaged me
up
too.
the
She's
last
like,
time
oh,
yeah, right. And she was like, ooh, no, too much, like shrunk it down too much, came off of it too fast, whatever it was. But she had tried, she kept going down and was like, okay, I'm going to just come right off. And all the symptoms came back. And I remember, I mean, this was years ago when I last talked to her about it, but she ended up having to take a very small, it was like 15 micrograms. So she had gone from 150 to 15, and that's where she felt her best. And so she
yeah.
just was like, I'm going to end there. That's my dose now.
Yeah.
So it can happen
Yeah.
somewhat,
Absolutely can. Yeah.
maybe.
It can. We can whittle it down for sure. Now I have seen patients come in where maybe their hormones are just in the toilet and their thyroid is, it's really, for us, I'll say borderline, not conventional
Yeah.
medicine borderline, but for us, it's like, oh, you're at 3.5, 3.6 for your free T3, your reverse looks good. Like maybe we can jumpstart this without
Yeah.
medication. We might be able to do, but if someone's on thyroid medication, there's also that negative feedback loop that occurs. And
Yes.
this is a whole other, ooh, I should put this, we should talk about this in the master class.
Yeah.
But people who go on this low dose of like a little bit of T3 or a little bit of armor thyroid. Well, okay, that's great. That's enough to shut your own thyroid down, but it's not enough to replace you. So you're actually going to get worse after that. So we have to be really careful about, if we're going to do thyroid treatment, let's do it. Let's get you optimized. You also want to,
Yes.
PSA announcement again is be very wary of doctors who say, let's just use a little bit of thyroid
Oh,
medication.
I
Well, that little
know.
bit can really screw you over.
Yeah, and make you almost feel worse. And
Yeah.
people like that's what else is going wrong. Is even if you do get medication from these practitioners, it's typically they don't understand how the thyroid works. So there's a negative feedback loop. It's a very strong negative feedback loop. There's some hormones that have a very little negative feedback loop, other ones that are huge negative feedback loops. Thyroid's one of them,
Yeah.
where you start taking thyroid medication and at first it's like it tops up your own. And then over a few weeks, your body goes, oh, there's thyroid medication in here. I don't need to be producing what I was producing. And
Yep.
it actually, then you end up having less levels than you did when you started the medication.
Exactly.
And so
Exactly.
there's a titration, which we can talk about in the webinar, just kind of more fine-tuned of what people can be doing as far as optimizing their thyroid and what they're looking for as far as symptom relief, et cetera, and how that titration should be. So the free webinar is going to be on April 1st at 5 p.m. Central, 6 p.m. Eastern, and 3 p.m. Pacific time. Um, as I said, free.
Yep.
But you do have to sign up. So it's at
Yes, on it.
fixyourthyroid.com/Karen Martell. I'm going to link to that in the show notes. Sign up. You're going to be able to watch the replay. So if you can't make it at that time, I wonder what is April
No,
1st?
you
Do you
got to
remember?
make it. You just got to block it out and make it. Because if you're not
Tuesday.
on there, you can't ask your questions.
Exactly.
So I did a 2 hour Q&A with people the other night. So if you want to ask your questions live, you gotta be on live. That's where the money happens right there. And I always tell people, listen, your question or someone else's question might help you and you might help
Yes.
someone else. So really, showing up live, taking the time for yourself, just for, block out an hour or two for yourself and put yourself first so that you can learn things that we do not talk about or teach on our podcast. There are things that I'll be dropping some bombs in this masterclass that you have not heard before. And then yes, we absolutely open it up to a Q&A, and it is just amazing. So you really want to mark your calendars and be there live.
There's nothing better than a Q&A.
I know.
Really. I
Love it.
love it. I do
I
them
know.
in my group every week. And I just think that it is such an opportunity to learn from each other and to feel like you're part of a community, even if it's a community of broken thyroids.
Yeah. It's
It's
all right. We
still,
got
you
each
feel
other's
like,
back.
oh my gosh, yes, exactly. It's like, oh, there's other people going through what I'm going through. And you just don't feel so
Hmm.
alone and depressed and know that there is a solution
Yeah.
where you can get optimized with your thyroid. And I think that that's really the takeaway from this conversation is don't settle for less.
Right. Right. Exactly. You have to demand like no more of the same treatment. No more. You cannot
No.
settle. You deserve to feel your absolute best.
Yeah. And if you're seeing a practitioner that's like, oh, I'm not going to give you medication because we just need to get to the root of the problem, or we're going to fix all these things first and then see, or here's your baby dose. I'm going to give you 30 milligrams of armor. And because you just shouldn't need any more than that. Or they're looking at your numbers going, oh my gosh, your TSH is suppressed and so is your T4. Oh, you're hyperthyroid. Well, you're going, actually, I'm 60 pounds overweight. I'm losing my hair. I can't get off my couch and I'm depressed. I don't think I'm hyperthyroid.
Yeah.
I think I
Exactly.
would know. I
Yeah.
remember Al actually saying that to me once. She's like, gosh, she said, you know, doctors, seriously, if we were hyper because our TSH is suppressed, guess what? We're going to know. We're going to be shitting our pants. We're going to be having heart palpitations. Like our heart's going to jump out of our chest. I'm like, yeah, that's so true. Hyperthyroidism is not a state that we want to be in. So when
No.
doctors are like, oh, you're hyper, like shame on you. That's the way I feel it is. Like my doctor did that to me. She was like, oh my gosh, your TSH is like you're hyperthyroid. And I'm like, I am not. And I'm not trying to get to be hyper. Like that's not a
Right.
fun place to be.
Right.
It's as bad as
Exactly.
hypo.
Yes. It really is. Yeah.
Like, do
Yeah.
you think I'd be taking all this medication every day if it was making me feel hyper? No.
No.
And I would be
Right.
really skinny. So clearly, this is not
And
happening.
it'd be really skinny. Exactly. 100%. Yes.
I'd have diarrhea and I'd be super skinny.
100%.
No,
I
yeah.
love this.
All right. Well, I look forward to our webinar. I think that that's really exciting. And I hope everybody that's listening can join. And we'll see you on April 1st. Amie, thank you once again for coming on the show. I always, always, always love talking to you. And I love everything that you're doing for women and their thyroid out there and their hormones. So thank you.
Thank you as well. I appreciate it.